So I started as a legislative staffer in 2004, so I've been around the Capitol now for about 11 years.
I met Jeremy when he was a senior in college. He applied for a job on my campaign. He was such a hard worker. He was so intelligent. He was so dedicated to the political process.
He has youth, he has intelligence, he has passion.
He is someone who is both compassionate but also pragmatic.
He was someone you could go to and trust with his judgment on any aspect of a campaign.
One of the things that I really admire of Senator Nordquist is the capacity that he has to pay attention what people say. If you are sitting with him in a meeting, he might be quiet, but what he's doing, inside is thinking about and paying attention what people are telling him.
He tries to bring consensus together in a collaborative nature, but he's very firm in the issues that he's passionate about.
In 2014, I introduced legislation to increase the minimum wage to $9 an hour, and we based that on research that Voices for Children had done that showed what does it take to be self-sufficient in Nebraska.
The greatest problem that children in this state face is poverty, and that poverty is caused by low-wage employment. Jeremy led that crusade, led that effort.
And he was able to bring a diverse coalition of organizations, community leaders, elected officials from all levels of government behind this effort because good public policy doesn't have to have a partisan label.
Talking to Nebraskans as we collected signatures, they got the issue of the minimum wage. They saw it every single day in their communities. Nebraska has one of the lowest unemployment rates in the country, which means people are putting in the work that it should take to succeed, but unfortunately that work just isn't paying, and our poverty rate and our children in poverty rate kept going up, and Nebraskans got that.
Nebraska has 8 school-based health centers that Senator Nordquist was very involved with the genesis for them and for the implementation of them and for making sure it was a smooth process to get them set up. He's really one of the key people that made that happen in Nebraska.
Well, it was clear from the beginning that the success of our communities depend on the success of the children in our classrooms, and if they weren't getting the physical health care that they needed and the other behavioral health services as well, they weren't going to succeed in school.
A lot of these children are uninsured, insured part of the time when they move on and off Medicaid, or they're Medicaid eligible.
In a traditional school with just a school nurse, we can only do so much, but with the school-based health center, we're able to kind of diagnose what's going on with the child, and if we can get them back to class, it's much better.
So a school-based health center looks very much like your doctor's office. It has a typical exam room. Some of the schools have multiple exam rooms. They have a nurse or a nurse practitioner or a physician's assistant.